So I thought this was a really interesting answer to a question that I had posed a couple of days ago about a rise that I've seen in my practice in breast augmentations. This person commented that there has been a recent push in the last couple of years to have more women breastfeed their kids. More women breastfeeding means potentially more breast changes that come along with breastfeeding, and maybe there's just a higher percentage of women that are now seeking restoration of their breasts. And I thought that this kind of overall topic was actually a really good point to make a video about and really just talk about breastfeeding and a breast augmentation. So the first thing is, can you breastfeed if you have a breast augmentation? And the true answer is I have no idea, because 70% of women can breastfeed at baseline. Not everybody can breastfeed, and your ability to breastfeed is not tied to the amount of breast tissue that you have. 70% of women with implants can breastfeed, 70% of women at baseline can breastfeed. So statistically, it's not going to change your ability to breastfeed. The second is it safe to breastfeed your child if you have implants? Now, typically the concern with implants has to do with the silicone. Silicone is present in both saline and silicone because they both share a similar shell, although their fills are very different. As somebody who has breastfed 2 children, I can tell you that the majority of infant gadgets as it relates to breastfeeding are all silicone based. So I struggled breastfeeding my first child, and I had a nipple shield that my daughter would breastfeed from. That's made of silicone. I used a Haka breastfeeding both of my kids to help collect milk on the other side. That is silicone. So if your goal is to not expose your infant to silicone, that is a very personal decision, and that's totally fine. But I'm just trying to point out that there is silicone in a lot of products that we expose infants to, and so simply just not having implants is not going to reduce that risk. And the last thing that I want to talk about is sort of, how does breastfeeding typically change the breast? And there is really one stereotypical change that we see in breasts after breastfeeding, and that is really loss of upper pole fullness, meaning the top part of the breasts. There are most certainly other changes that happen. Breasts get saggier, they get droopier, they stretch out, they may just lose overall volume, but really that kind of characteristic breastfeeding or post-breastfeeding breast is really going to be a loss of upper pole fullness, and really a breast lift is not going to be the most effective way to manage that. It's either going to be an implant, or sometimes we use strategic fat grafting for that. So if you guys have any questions as it relates to breastfeeding, breast augmentation, or kind of anything plastic surgery, leave those in the comments below, give me a follow, and I'll do my best to get back to them.